Hi, I'm here to tell you a little bit about my experience, which was on April 2nd last year with the Hospital for Special Surgery, which is a wonderful institution because they really care about their patients. And not only that, from what I was told directly, their hospital rates #1 in the country for the lowest infection rate. And I can tell you that the experience definitely is probably true, because I had Dr. Nawabi, who was the only one among the whole crew of the different specialists who was able to deal with my particular situation. I had a fractured femoral head, which I didn't know about until they saw the MRI, and it took me about 4 months to finally get an appointment with Dr. Nawabi. I'm very grateful to Dr. Nawabi because he is a very caring doctor. In spite of the fact that I came there 2 weeks early for my appointment with him, they let me wait till the end of the day, and I was sure that Dr. Nawabi would be very busy and angry that I came there in spite of, the date wasn't the correct date. And yet he took a lot of time to ask me about my dance career and what I do in the water, because I had done water exercises prior to my left hip replacement, which was actually 10 years ago now, with Dr. Jaffe, another excellent doctor at NYU. And I'm now doing my own water exercises, which you will see in a little while. And it's a lot of fun because I made them up. Being a dancer, I kind of instinctively know what works for me. But I believe that some of these exercises that you're going to see and that I want to share with you on this video are actually things that you can pick up on your own. And the fun part is, if you have these long barbells that you see in the picture or in the video, they really help to give you a lot of stability in the water, because you can go into the deep water end. And that's the most important thing about doing this type of personal physical therapy in the water, to not have any impact on the joints. And then you can do walking or jumping in the water, and it's a really fun type of activity to be able to do as soon as your doctor lets you do that. So again, I just want to say that I have a lot of appreciation for the Hospital for Special Surgery, and their motto is getting back in the game. And I'll tell you, they really do a marvelous job, especially from my experience with Dr. Nawabi, because he was very interested in knowing what types of exercises I had done before, and I showed him, and he felt that I was a good candidate because of my active role in my personal health. And of course, you do gain some weight. I have to say, I may not look it because I'm tall, but it takes a while to get rid of that extra weight. But it's a process of relearning and rethinking your body and your mind, and being so much more appreciative for so many things that we take for granted. So I think that's one of the biggest lessons from this, and you can definitely look forward to an improvement, and you see yourself each month having new abilities that you didn't have earlier. So it's very exciting to be able to see those improvements little by little, and it encourages you to feel happy that you decided to go forward with this. So I hope you'll enjoy the water with me. Thank you. Hi, this is about 10 months after the right hip replacement anterior by Dr. Nawabi, who's a wonderful wizard. And I have to say that the water is a great assistant to the doctor, because you can do so many things, and you also have to be careful not to overdo it, because it's a little deceptive. There's a lot of more mobility in the water, and then if you overdo it, you might feel it later. So you have to go gently at the beginning, but you can do things like bicycle movements. You can also do leaps, stag leaps in the water. And holding on to these barbells helps a lot, because it sort of stabilizes you in deep water. The deeper the water, the better, actually, because then you don't have any impact on the joints. So now I'm just going to show you a few of the movements I like to do. This is one where I invert from the back to the stomach, then I stroke I stretch my legs straight and I let them go sinking down to the water. Good sides. And I push and turn. And then I let the water pull me down. And then I do also, this is called cross-country skiing, they told me. Then you can also do jumping. Jump and fall. You know, jumping jacks. And then the articulation of your thigh and your leg. Turn out and turn in. And I want to say that I had the left hip replacement 10 years ago, which was the posterior, I think it's called. And it was a very different kind of healing this time. It was much quicker. I was able to lean down and reach for things, but I also have to be careful because it's a whole new balance situation. So every month is a new learning experience, and you find out the body tells you what it wants to do rather than the other way around. So it's almost like a baby learning how to walk. Each month is a new progression, and you actually see and feel different mobility that comes back. So it's really a wonderful outcome. And I have to say that Dr. Nawabi is a very fussy, precise genius. That's all I can say. I was asleep when it happened, but I really trust him implicitly with his caring, and he's a very humanistic, caring doctor. So that really helped too. Know that he'll be available if you ever have any issues. He calls you right back. He's very fussy. He didn't want me to perform, but I did do so after 3 months, and I went swimming about 2.5 months later and had to go easy. But I do recommend anybody who's had this surgery to get into the water as soon as you can, because it just helps you to move around, and you feel really great afterwards, and you're getting to move a lot of joints that maybe normally you would be careful about not moving. So I'd like to recommend doing this as a supplementary exercise, because it also helps your knees and the other joints, and they all kind of work together. I'm going to walk or jog in water without these barbells, and this is deep water, but it's a way of also mobilizing your thighs and the back of your muscles that help you to walk up and down stairs. So I don't do running on land, but I'll turn around. It kind of looks like a dog paddling. I don't like to do too many of these because you might feel it in your thighs after a while, so everything should be done in moderation. There's something else I like to do at the edge of the pool. This is a really fun thing. You hold on to the bars like this. I usually take the opposite arm and pull here, and then I stretch and pull torso. The water kind of shifts you around, so it's not like a dance class where everything has to be in place. But by doing this, it pulls everything. And then you do that on the other side. Take this opposite arm over here. And then another thing I like to do, I have to get these out of the way, is the pull-ups on the bar. Here, like this. And then you can put your feet here and contract and stretch back. I wouldn't do too many of them. Whatever you do, you should do fewer than you would in a dance or exercise class. Just like less is more. So this is good too. Any kind of stretching and pulling away helps your underarms too. using contrasting isometric use. And then I like to do the arabesque movement, turn out, and the water just floats your leg. So you have no pressure on the ground. You just do a low arabesque, and then to the side, and down. These are a lot of fun because you can stay in the water for quite a while. You can also put them under your arm and have your hands free. Hands free. Walking in water is a lot of fun. And then you can do a jump like an envelope, it's called in ballet. You go straight and you pull in. As opposed to a développé, turn in, which is bending the knee and straightening. The envelope lets you have a little jump in your step. And then again, it doesn't matter whether your placement is perfect or not because the water is very forgiving. So if you're a little off balance when you're jumping, it doesn't matter because you land very softly in the water. So you don't really hurt anything. I'm going to demonstrate that one again, but sideways. So first you stay, then you push and land on your stomach. Then you straighten the leg, and then the water pulls you down. I was very happy to be able to get to the hospital for special surgery for many reasons. And one of the important things is that they are very proud to let you know that they are #1 in the country for the lowest rate of infection. And it definitely seemed to be the case because they were very particular in the hospital rooms and they treated everybody very well. The patients are listened to. And I have to say that the surgery that Dr. Nawabi did really was an unbelievable one because it wasn't easy, I'm sure. I wasn't awake when it happened. But it took a while, of course, to recover, and I had already had, so to speak, a dress rehearsal having had that with the left hip. But the left hip that I had replaced was actually from the back, posterior, I think it's called. And this is a fairly new approach, and I know that not many of the doctors who have been doing the other method are into that. So Dr. Nawabi is really in the forefront of this particular type of surgery. And some of the advantages are that you can actually lean down without a special stick to pick things up when they fall down. And I saw other types of improvements too, because very gradually, each week, I had more mobility and ability to have energy and wanted to get outside. And the physical therapist came to the house. I asked them to let me go outside and walk around, and I practiced daily functions. And I think that's probably the best kind of therapy you can do, is to, as soon as possible, start moving around and get someone to take you by car or whatever transportation is possible, and do what you would normally do as much as you can without carrying heavy items. So I have to say that I was very grateful.